This presentation comes from the United Republic of Tanzania, which is a large country bordering the Indian Ocean in Eastern Africa. It has 60 million inhabitants, 60 million inhabitants, with an average age of 17. It's a mostly rural country with a few large cities like Dar es Salaam, the Indian Ocean. You can hear the rooster outside. This is a very rural setting. We even have all kinds of animals around hospital, sometimes in the hospital. Tanzania was recently classified as a lower middle income country, but it's one of the poorest countries in the world if you look at the world ranking. And the world is just gradually getting more wealthy overall, but the differences are also huge. I'm Marieke Dekker. I'm a neurologist and manager of the spinal cord unit in KCMC, Kilimanjaro Christian Medical Center in Moshi, northern Tanzania, at the foot of Kilimanjaro, the highest mountain of Africa. And we have the only spinal cord unit in Eastern Africa equipped with research, training, and patient care. And we are going to talk about a recent challenge to spinal cord injury care in the world. And of course, you can classify this in many ways, and climate change is a challenge that we all face, but it has been superseded by a more acute threat, which is coronavirus and the epidemic that holds the world in its grip at the moment. Tanzania is a very special country because at the moment, no figures are known about the entire country, and the ministry stopped publishing those after the first few cases, which is an imaginable challenge for any extrapolation or statement, and we can only express ourselves in global statements. But what we know is because of the average age of teenage, 17 for this country, the presentation overall seems to be milder, and we know that many cases will go unreported. So what this means is that we have an acute threat of the virus itself to our population, but what we have seen is that the indirect effects for our patient population in the hospital and at home is actually much larger and will be ongoing for a long time after this coronavirus epidemic has been curbed and vaccinations, etc., have become available. So what it actually has meant is an acute lack of resources, an increase of lacking resources for everyone. An illustration of this is the sheer fact that the corona isolation ward is our spinal cord unit. So our spinal cord unit was taken away from us to become the corona ward. It was cleaned out. Patients were sent back to the general surgery ward, and that is where we have to look after our inpatients at the moment. So we try to do this with a young and ambitious team. We are a multidisciplinary team with spinal surgeons, orthopedic surgeons, urologists, neurologists, occupational therapists, physiotherapists, and nurses. This means that our multidisciplinary care in a cramped surgery ward is different from what it was before, but we try to do our very best to maintain a level of care. What is a good illustration of the situations our patients are in is the fact that because they are often paralyzed and quite vulnerable, and patients were initially required to wear masks in the hospital, the nurses in the general surgery had a level of experience which meant that they didn't understand that our paralyzed patients could not adjust their masks. So when we rounded, patients had masks over their eyes, under their nose, or were borderline respiratory insufficient. and couldn't breathe through the material of the mask. So we have specific challenges to face after this coronavirus epidemic took place. The burden of disease is difficult to estimate because we don't have figures, but we have first-hand experience from the second largest hospital in the country, which suggests that the epidemic behaves differently from elsewhere in the world, where we have very well documented trends such as Europe and North America. But I think we will bear the biggest brunt long after this because of an overall decline in resources and healthcare demand due to this acute interruption. So if you call the coronavirus epidemic a disaster and climate change a disaster, it's important to realize that countries like Tanzania and many other countries, in fact in sub-Saharan Africa mainly, do have a number of disasters to cope with. And they have been coping with that for a much longer time than coronavirus. And many such disasters or problems which in other countries would be coined disasters had they occurred to the extent that they're occurring in this continent. But they've been there forever and people have kind of forgotten about it. So in terms of disasters, we are a continent that has already been able to cope with and to grapple with multiple challenges and disasters. And to mention an example is the fact that poverty causes an enlargement and amplification of lots of other problems in healthcare. A difficult and challenging political situation and, for instance, unsafe traffic circumstances are another example, which cause a silent epidemic of motorized vehicle associated injury and especially spinal cord injury. So, and if that's not enough, of course, we have diseases which are almost directly identified with sub-Saharan Africa, such as the HIV/AIDS epidemic and tuberculosis. And we know that tuberculosis was, and will be a bigger killer than coronavirus. And those are things that I think we need to stress because coronavirus is disrupting everything at the moment, also for our spinal cord injury patients. But in this country, it's not the only thing that we are coping with as healthcare workers and as patients. So just to address the additional challenges of climate change in Tanzania, you see a beautiful mountain here, Mount Kilimanjaro, almost 6 kilometers high in altitude. But that this mountain is a symbol of climate change because it has a melting ice cap, which has considerably shrunk over the years and will continue to do so until this tall mountain is nothing but a grey lump of stone protruding from the landscape. What the climate change indirectly does to this region is mainly deforestation, and deforestation causes erosion and floods. And you can imagine from a mountain as prominent as this one, surrounded by flat plains, the Maasai plains, mudslides and floods can be devastating. And these are the circumstances that our spinal cord injury patients have to live in. So if you see these challenges and you realize that on top of this unique and exemplary climate with rough roads, floods, inaccessible infrastructure and delays to come to a hospital. We have an increasing lack of resources due to the coronavirus epidemic, closed aerospace, halted income by tourism, less border traffic, and living in a country which has some lack of official figures by which it's being ostracized in the international scientific community because we can't give figures. But also indirectly in the global economy, because people such as tourists are afraid to come back to a country of which they don't know what they're up to. So it has influence on travel, on trade, on tourism. And these things will become increasingly clear in the future. So, of course, this was a bit of a gloomy message, but we have a very positive message to end with, because we always try to bring the positive message across, but we can't do that without signaling the situation from which we bring that positive message. So activities in our group include the recruitment of peer groups. You just saw a little peer group led by Faustina, one of our peer group workers who talks to patients in our unit about all kinds of issues related to their injury. Another thing which is incredibly positive is a day for tomorrow, which is an accessibility walk, of which you see a picture here of last year's walk, which we will definitely hold again this year, which is ironically the advantage of being in a country without restrictions, because there are no restrictions in Tanzania because government has denied the ongoing coronavirus epidemic and says it's over. So with some cautions, we can reinitiate activities which will be for the benefit of the image and awareness of our spinal cord injury team. And I think what is important for our team is that we are many. We are academic professionals, we are nurses, but we are also peer group supporters, people who've had a spinal cord injury and were admitted in this hospital themselves. And such people, for instance, will be doing a school visit. So they're going to secondary schools to explain that access for their disabled students is very important, and will give the example by telling their life story to motivate school administration, but also the patient and family to return to education, because education is everything. We perform research as well, and in this research, our principle is that we want to focus on ongoing trends. We have a nice database, and we always involve different disciplines. So nurses, occupational therapists, physiotherapists, which is a great interaction and good team building. We've already published a number of articles. This is an impression of our team together with a patient. And I wanted to wrap up with a little message here, and that is the two little friends who are actually talking to my presentation at the moment, but are very important helpers in raising awareness, because they say, if we get space, we can do it. And that is exactly what we advocate for our patients, but also for our spinal cord injury team, because with the little space we have, we will show that despite a coronavirus epidemic, we will try our very best to maintain a level of care whilst continuously monitoring what that does to our patients and does to our quality of care. So thank you very much.